Good morning. My name is Stephen Guffey, and I'm Associate Professor of Physical Therapy at Arkansas State University. And today I'd like to share with you a new technology for treating musculoskeletal injuries. What I have is a Thermostim probe. Thermostim probe is a device that allows us to deliver both heat and cold as well as soft tissue mobilization. The device has a Peltier device on the back side of this probe that you can see here that will allow us to do either heat or cold. Plus, the edges being flat or sharper allow us to do soft tissue mobilization if we desire to do so. At the same time, we're going to be delivering electrical stim through the probe. The patient that we have today has injured her anterior lower leg. She's a soccer player. She had not yet put on her shin guards when she was warming up and suffered a blow to her anterior lower leg along her tibia. She has a contusion there and quite a bit of tenderness. This happened just a few hours ago, so it's quite acute. And we're going to treat this with cold and electrical stim. Our electrical stim delivery will be a biphasic waveform. We'll use 100 pulses per second and 50 microseconds pulse duration. So here's how we'll go. We're going to apply the probe, which is delivering cold, on the smooth surface because we're not going to be mobilizing the soft tissue since this is an acute injury. And then we're going to bring up our electrical stim to a sensory level. So let me know when you can feel this. Good? And we'll start there. We're going to deliver this treatment for about 10 to 15 minutes, covering the whole area of the injury with just a light pressure. We're not trying to mobilize the tissue, as I mentioned, but what we are trying to do is deliver very focused cold and then electrical stim for pain control. What we're hoping will happen is that we'll relieve the patient's pain, we'll kind of eliminate some of the potential edema that will be forming, and she'll be a happier camper. Then at the end of the treatment, we're going to compress and elevate, and then we'll do this treatment very regularly, a time or two a day for the first couple of days, and hopefully we can progress her through this acute injury fairly rapidly. It's a very simple technique. We're combining cold and electrical stim using the new Thermostim probe.